Welcome, ladies and gentlemen, to yet another interview on Africa 24. Today, we will be receiving Professor Henry Fomundam, expert in pharmaceutical sciences and public health. He has worked in the United States of America and several African countries in areas of academia, medicine regulation, clinical trials, pharmacovigilance, and he has equally managed several HIV programs. With him, we will be talking about the panic around COVID-19 vaccination, as well as some of the social inequalities these vaccines are orchestrating across the world. While cases of contamination seem to be on the rise in some African countries, the question about vaccines continues to bring controversy among the African population, such points that Professor Henry Fomundam would throw more light on. 1 year after the advent of the COVID-19 pandemic, some people remain skeptical about the existence of the disease. What message can you pass on to the African population, encouraging them to better protect themselves against the virus?
I think the issue that we have is not awareness as much. It's the behavior change, sustainable behavior change, and health-seeking behavior. Sustainable behavior change means how do you make the people to be able to consistently wear the mask, wash their hands, and keep the social distance. That is the challenge. And health-seeking behavior basically means how do you convince people that as soon as you have symptoms, you should be able to go to your local clinic or go to your local hospital and not wait for a very long time, because in Cameroun and most African countries, people wait at home for a very long time before they come to the hospital, and a lot of times that would be very late.
Why so much conspiracy around the COVID-19 vaccines, considered by some to be the most effective way to protect against the virus?
This is a different time where we have a lot of Africans are experts in their own field. There are a lot of scientists. The government has to work with its population, with its scientists, to make sure that people are giving the right messages. In the rural areas, there must be experts that come from that area. There are opinion leaders that come from that area. The government should engage them. They should be the ones to be able to engage the population so that we can significantly reduce some of the conspiracy theories. It's not only about the vaccines, it's actually about the COVID-19 itself, in the sense that a lot of people don't believe in it, and subsequently when the vaccine is around, a lot of people are not very sure about it. We should also make sure that we get our local communities, we get our local scientists, our experts. We have enough of them to be able to explain how the vaccine works and the benefits of the vaccine.
What advice can you give to the African population to encourage them to get vaccinated and overcome their phobia concerning the vaccines?
To make sure that the communication that you have should be very simple, should be very honest, it should be very direct. Engage the private sector, engage community leaders, engage the local opinion leaders that you have in your country, especially in the rural area. This intervention cannot be successful if you do it top to bottom. It has to be bottom upwards. So the government has to be able to engage in that, go to the communities, have a strategy for the urban area, have a strategy for the rural area, engage the people, engage the local people, that people see them on a daily basis, people trust them, and be able to engage them to inform their population. That's going to work better.
Considering thrombosis as one major complication after vaccination, can you clarify the vaccinated population on the symptoms of thrombosis that the individual should control after their vaccine? And when exactly after vaccination do these symptoms appear?
There have been a few patients or few people that have taken the vaccine and come down with a clot. Most of it has happened in the brain, but some of it has happened in other parts of the body. For the most part, when you get the vaccine, you're going to have the normal adverse drug reactions that we expect. You'll be hurting at the site of an injection, some fever, some tiredness. But if you have consistent headache, then you have to report that it could be something different. And usually, the normal expected adverse drug reactions would last for like a week. But when we start having headache during the second week and third week, you need to report that. People react differently to medications. We have different physiological systems. And so the average time is going to be 2 weeks from the cases that we've reported. But some people report longer than 2 weeks. The issue is telling people that if you have persistent reactions or persistent adverse reaction, be it headache or anything else, you need to go back to your clinic, you need to go back to your hospital, you need to go back to your nurse or doctor, whomever, the system that has been given to you, and report that that's what you're having.
As a professor working in the areas of pharmaceutical care and public health, what advice can you give to the African governments in choosing the most appropriate vaccines for their populations, since some assert that the effectiveness is not the same?
When it comes to selecting medicines, be it a vaccine or other medicines that you have, particularly when you have similar medications or medicines or vaccines in the same class. In the case of the vaccine, the very first thing that you have to do is you have to establish what kind of virus you have in your population. What is the predominant virus? So you need to establish what variant do you have. The reason being that we already know that the effectiveness of some of the vaccine is not very good against certain variants. The next thing that you look at when you're selecting medication is the issue of cost. You look at cost effectiveness. The fact that a medication is the cheapest may not necessarily mean that it's the most effective. The last thing that you look at is the logistics.
Most Africans have turned to the use of traditional medicines as means of prevention against COVID-19. According to you, what can be its contribution in the fight against the virus?
It is the role of the government to help, and the academic institutions to help some of the traditional healers in order to transform whatever medications that they have. It has a role, but it needs to be modernized. It needs to show proof that your medicine works. The African governments will have to make sure that you have a database that has the traditional healers and that you have in your country, and be able to now work with them to make sure that if they have treatment that they make claims for it, it's good to investigate using your academic institutions, your research institutions in the country to find out, is there anything viable here? Is there anything that makes sense in terms of this intervention?